Welcome back to Plant-Based Kidney Health, everyone. I'm Michele Crosmer, renal dietitian with Dr. Hashmi, nephrologist. And my question for you today, Dr. Hashmi, is can you discuss the link between thyroid and kidney health?
Yeah, so this is going to be a complex and fascinating topic. But, the first thing you want to understand about the thyroid is on the episodes we've done in the past, Michele, I don't think we've ever done one on the thyroid. We've done all parathyroids, right? So this is going to be different, guys. Remember, para means next to. Parathyroid is totally different. That gland was responsible for bone health, for your calcium, your phosphorus going on, completely different. With the thyroid, the two main hormones that the thyroid produces are essentially your T3 and your T4 going on. Now, what's really interesting, this is kind of like the chicken and the egg story. What we know about hypothyroidism is that patients who have kidney disease have higher prevalence of hypothyroidism. And people who have higher prevalence of hypothyroidism can often be found to have chronic kidney disease. So let's talk about first one way, then we'll talk about the other way. So now we're going to talk about how chronic kidney disease leads to hypothyroidism and why, if you have chronic kidney disease, you want to actually get your test done for your thyroid stimulating hormone, your T3, T4, to know what's going on. So in CKD, oftentimes your TSH or thyroid stimulating hormone, it's going to be normal. But you want to understand that the response that TSH has to basically, the way hormones work is signal 1 leads to signal 2 leads to signal 3. So your thyrotropin releasing hormone acts to cause the release of TSH. But in chronic kidney disease, that signal that comes down to say you need to release more thyroid stimulating hormone is actually delayed and blunted. So you don't release it in the same manner. So even though the TSH is normal, it's not responding the same. It's much slower to be released. Number 2 is in chronic kidney disease, you have decreased conversion from T4 going on to T3, and you're going to end up having low amounts of T3. So in CKD, you're looking at lower T3 going on. So when you get your blood test, you want to check for T3, T4, and TSH. Now, also, the more toxins you have, the more uremic toxins, and the more inflammation you have, the lower your T3 is going to be. So this becomes very important because, once again, CKD, more hypothyroidism. Now, also in CKD, if you have metabolic acidosis, remember the acid in your blood is starting to increase. The more that acid increases, the lower your free thyroid hormone levels are going to get. So that's another mechanism going on. Then when you have CKD, as the kidneys get worse, you actually decrease the iodine clearance going on. So there's something called the Wolff-Chaikoff effect, which basically says when you have essentially larger amounts of iodine in the body going on, they actually inhibit thyroid hormone synthesis. So in other words, as the kidneys get worse, you're going to release less iodine clearance from the kidney going on. That iodine is going to build up. It's going to act on your thyroid glands, and you're going to have less thyroid hormone synthesis going on. Then the final part of this is that in chronic kidney disease, you'll have increased prevalence of things like goiters going on. And why? Because as the kidney's clearance goes down, the ability of the kidney to get rid of essentially substances that cause goiters goes down. What are those substances? They're substances like aryl acid. So what happens as these substances start to build up in the body? They will cause the thyroid gland to get larger going on. And then the last part is when you have nephrotic syndrome, you're spilling more than 3 grams of protein in a 24-hour period going on. What you're going to end up seeing is there's a loss with that protein. There's a loss of thyroid hormones going on. So now we've discussed all the ways that CKD leads to hypothyroidism. Now let's flip that around. How does hypothyroidism lead to CKD? In other words, how does hypothyroidism lead to worsening kidney dysfunction? Well, there's a few mechanisms there. One is there's a decrease in cardiac output seen in hypothyroidism. Why should you care? That means there's less blood being delivered to the kidneys, so the kidneys are essentially starving. That can make it worse. Next, with hypothyroidism, you will see that in terms of what's happening at the level of the kidney, there's more vasoconstriction. So the blood supply to the kidneys is actually constricting going on. And part of that is because the substances that actually help to dilate the kidneys, their synthesis is going down and their ability to function is going down. As a result, what are you doing to the blood supply? You're decreasing it. Then the next part is when we look at the pressure that's actually happening on the kidney going on, it actually increases. So there's increase, essentially glomerular pressure that's present there. And that also can lead to kidney dysfunction in the future going on. So now you understand how hypothyroidism can make the kidneys worse and how chronic kidney disease can lead to making hypothyroidism worse. So it's a circular thing. But then what about hyperthyroidism? Well, in hyperthyroidism, you can actually make protein in the urine worse, and that can cause kidney disease to worsen. So we've done all these episodes talking about how to make chronic kidney disease better, how to lower the protein in the urine going on. Well, hyperthyroidism is something that can do the opposite. The other thing is with hyperthyroidism, you're going to see all this increased blood flow. That increased blood flow is going to lead to increased pressure in the kidney. You're going to get all sorts of hyperfiltration. What does hyperfiltration do? Adds so much pressure inside the kidney, leads to damage of the kidney. You end up getting worsening kidney function. And the last thing is when you look at hyperthyroidism, you actually have a lot of generation of free radicals. And those free radicals, as they end up floating around, will also damage the kidney. So that is a huge amount of episode information to cover in one topic. You might have to watch this again. But bottom line, hypothyroidism can make kidneys worse. Chronic kidney disease can make hypothyroidism worse. Hyperthyroidism can also make kidney disease worse. There you have it.
All right. Thanks, Dr. Hashmi.